Queensland Health has issued an urgent warning after 2 people died taking fake medication.
I am a registered nurse with years of experience in bedside nursing. I have seen my own fair share of how this works, and I am telling you that most times the solution is not the drug. You would realize that stress does connect to most of our illnesses. Then we go to the hospital to get a prescription instead of tackling the main cause. I have seen patients get addicted to their legally prescribed medication overdose, and fake medication is on an high time rise. Pharmacological companies are just interested in making their financial gain, and the rest of us, well, we just want to survive.
The black market drugs appeared as Xanax, but were spiked with a deadly opioid. Police authorities warn users may not realise the pills are fake.
I grew up with a woman who wasn't faced with modern medicine. She wasn't just convinced enough. She didn't joke with her herbals. She didn't joke with her garden, which was our source of organic food. When I got admission into nursing, and I needed to study, I needed to learn, I needed to get involved. We have been conditioned to see the medical field and the pharmacological world as the solution. But in reality, no true human system is the same, no matter how scientifically based the system is. Focus should be on the stressors, on our financial worries, on our traumas, on our stressful jobs and careers, on our horrible relationships. The focus should be on the root causes, on what led to the stress, what led to the weight gain, what led to the trauma, rather than relieving by prescribing drugs. And if you say you want to focus on the medical field itself is fucked up. According to the Journal of Patient Safety, 440,000 people die every year in the US from medical errors, preventable medical errors, surgical errors, errors from wound breakdown, errors from infection, preventable errors. How about diagnostic errors? Misdiagnosis, delayed diagnosis leading to deterioration of patient symptoms. Even the almighty Hippocrates, who is known as the father of modern medicine, will be laughing at us now. This video is not about errors, so I'll spare you the detail. Work also is on an all-time rise, leading to chronic stress. If you look very well, most of our problems result from stress. Small stress here, small stress there, leading to something complex. Chronic stress that impairs our sleeping pattern, mental disorders, leading to mental disorders, depression, weight gain, even hormonal imbalance. Stress happens to be the root cause of all of our problems. Think about anxiety. Think about our physical state, how stress affects us physically. Think about our cardiovascular system, how stress definitely affects the heart. Think about even our digestive system, the way we eat, what we eat, and even our taste buds and what we feel like eating that day. If you are in the medical field, you would realize that stress does connect to most of our illnesses. Then we go to the hospital to get a prescription instead of tackling the main cause. Even our foods can come to the rescue again, because they are not as natural and healthy as they were centuries ago. They are now genetically engineered, just so we could have it easier and faster. It's a wonder why Hippocrates said, let food be your medicine and your medicine your food. I am not saying you shouldn't take your drugs. I am rather saying you should go back to the drawing boards and look at your lifestyles, look at your past traumas, look at your career, look at your relationship. Truth is, if you keep taking these drugs that you're conditioned to take to treat the symptoms, and you do not address the root cause of this condition, then it's going to be a repeated thing. It's going to be a cycle that keeps continuing. We keep telling ourselves that the reason why we are conditioned like this, or the reason why we are being stressed, is because we are poor. The reason why we're still in that stressful relationship, that stressful job, is because, we're poor, we need to eat. But the truth is, there will always be poor people. That's how this world works. There will always be hierarchy. But if the poor people keep giving this excuse, it means it's a never-ending cycle, right? I am a registered nurse with years of experience in bedside nursing. I have seen my own fair share of how this works, and I am telling you that most times the solution is not the drug. The solution is just within us, in our kitchens, in our houses, and in our homes.